Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT with Me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check us out at sptwithme.com for your prep courses. Now for what you're actually here for, let's answer the question of what are functional outcome measures? I'm going to answer this question through a scenario. What I'd like you to do is imagine that you are working at an outpatient clinic. Now just imagine any patient that has resonated with you, but specifically at an outpatient clinic. And this is the first time that you're meeting this patient. You've read your chart review and now it's time to go to the front desk or the waiting room and you're calling them back. Now, as soon as you call their name, whether it's just themselves or maybe they have a caretaker with them or family members, whatever it is, you're already assessing them. You're looking to see if they're using their hands to push from a chair. You're looking at their posture. You're looking at their gait. And even if this person's in a wheelchair, you're already assessing them. You're looking to see how they're positioned in this chair. You're looking to see if they're leaning on one side more than the other, or if they're rotated, or if they're having any tone, things like that. Now, let's say you've done your evaluation and you've done all that you can, MMTs, range of motion, whatever it is, balance tests. You as the therapist, when you reflect in the future, how do you know that you are actually making your patient better from evaluation day to the next progress now? How do you know? For example, does better mean that, I got this patient who has been moderate assist and standing to maybe being able to stand for 2 minutes straight with min assist? Or does it mean that I got this patient to be able to stand independently for maybe 1 minute versus 2 minutes? Or that this patient, is now contact guard for 30 seconds? Or is it that my patient's knee flexion increased by 5 degrees? Or does it have to be 10 degrees? Or is 20 degrees what is considered better? Ultimately, with all these situations, I'm asking, what is the threshold? Is there a minimum? Is there a maximum? And how would you know? So what I'm trying to say with all these examples is that we as physical therapists cannot just rely on what we feel improvement is. We have to have something that at least gives us some sort of guideline that says, yes, your patient is actually improving. And this is where functional outcome measures come in. This is a resource that provides us some sort of guideline to help us justify whether or not physical therapy services that you're providing are actually making a difference to your patients. And in addition, it also helps to provide a guideline on maybe what to think about with respect to our patients. Maybe thinking about what specific tasks actually matter in our everyday lives, or what kind of things should we be able to do and make sure that we're safe in doing in our everyday lives. Things like that. Normally, when you think about a functional outcome measure, you're probably imagining a sheet of paper with a list of tasks to have your patient do, or maybe a questionnaire that you're going to have them fill out or an answer. Now, ultimately, yes, this is true. That's kind of what they are. But if you really take a step back and think about what it is, these sheets of paper consist of very specific points of interest with respect to the goal of the outcome measure. So for example, if I have a new patient and I'm taking a look at the way that they're walking without an assistive device, and honestly, they look a little unstable and it kind of worries me about them tripping over something and falling in the near future, I want to have a resource that essentially justifies that what I'm thinking is true. Or let's say that I have a patient who has balance problems, but I can't really tell exactly what's causing it, whether it's vestibular impairments or sensory impairments or visual impairments. I can find an outcome measure that helps not only show that the person has balance deficits, but might actually tell me what it is that I need to help my patient with. Additionally, functional outcome measures generally give some insight on what you should focus on. For example, as much as I don't want to be ageist, we as a species should be able to hit certain benchmarks when it comes to physical performance. Let's say I'm 60 years old. I should be able to perform a certain number of sit-to-stands, maybe walk a certain speed or perform a task within a certain period of time. These sheets of paper that you're thinking about give us all that information. All the hard work of coming up with these numbers has already been done. You just have to make sure that you know how to choose the right one for your patient. To touch on one more thing about functional outcome measures, let's talk about where they come from. Essentially, it's from the work that a bunch of clinicians and researchers did. So I'm going to give an example. Let's use the timed up and go. This is a very widely known outcome measure. Now, maybe the first thing that comes to mind about the timed up and go is that if your patient completes it in, let's say, more than 10 seconds, this is going to suggest that they are likely to be a fall risk. Now, this is a very generalized statement. I can have a person who has had a TBI, or a person who's had a stroke, and a person who's had a hip replacement, or even a person who is 16 years old versus 74 years old, etc. How can this be a global fact? Well, what happened is, I'm sure you can imagine that whoever created this test, or these group of people who created this test, they compiled a bunch of people and they collected all this data and all this calculations and all these numbers from these people that performed this test. And of all the people who performed this task in under 10 seconds, statistics shows that they were less likely to fall within maybe, let's say, the next year. But then they also noticed that everyone over 10 seconds had a higher likelihood of falling within the next year. And the longer that they take, the higher likelihood it is that they would have a fall. Now, that doesn't ultimately mean that, if I can perform it in 5 seconds, then I'll never have a fall. It's always possible to fall, but we do our best to prevent them, of course. So this was the start of it all. Now, some other researchers down the road, they came in and they said, well, what if I made the test a little bit more specific? And what if I perform the same test, but I choose people who are specifically diagnosed with Alzheimer's disease to perform it? That way, we're not comparing between a bunch of different diagnoses. So I'm going to get a bunch of people who have Alzheimer's. I'm going to have them do this task. Then I'm going to look at all the trends that I see in the amount of time that each person takes to complete the task, and then, down the road, see what their likelihood of falling was within a certain period. So the same idea goes with any and all outcome measures. I'm going to choose a specific task, I'm going to have my patient perform it, and then the results of that task are going to show me an expectation from it. Now, again, it doesn't always have to be only one task. For example, another very popular and widely known outcome measure is the Berg Balance Scale. And here there are 14 tasks. So the people who created this outcome measure realized that these specific 14 tasks, when you put them all together, they have a very good correlation with determining whether a person is going to be at risk of falling or not within the past year. Of course, not all outcome measures deal with fall risk. Some of them deal with general strength. Some of them deal with balance. There are ones that deal with perceived disability. So there are many, many different types of functional outcome measures. But the researchers did all this work for us. We just have to know what's out there again and choose the best one for our patients. If you enjoy learning material in this way and you're studying for the NPTE, check out our prep courses at sptwithme.com.